Hello, good afternoon, and welcome everyone to the American Lung Association's North Carolina Community Connections. Today's webinar is presented by Novant Health. My name is Lauren Love, and I'm the Executive Director of the American Lung Association here in North Carolina. Before we begin, I'll share a few housekeeping items. This webinar is being recorded and will be made available after the session. It'll be on our national YouTube page. Also, please submit questions for our panelists through the Q&A button. We will do our best to answer all the questions at the end of the session. If you submitted a question when you registered for today's webinar, it's in our script. We'll make sure that we cover that today. So today's discussion is going to focus on leaving tobacco behind. We'll be diving into the health effects of tobacco use, effective quitting strategies, and the latest tools and resources to support people on their path to quitting. We'll do our best to keep today's presentation to no more than 30 minutes, but we will extend the webinar just 5 additional minutes to accommodate for more questions if needed. So if you could go to the next slide, please. We are fortunate to have some amazing experts on today's panel to guide us through this discussion. I'll give just a brief introduction of our speakers, and I'll send their full bios in the webinar recap email. So with us today, we have Dr. Jeffrey Walls. Dr. Walls is a board-certified specialist in pulmonary critical care and sleep medicine with over 3 decades of medical experience. He earned his undergraduate degree from the University of Illinois and then completed his medical degree at the University of Chicago. Dr. Walls served in the U.S. Air Force, completing his residency and fellowship at Wilford Hall Medical Center. He continued his service as a pulmonary and critical care attending physician there until 2003, when he then moved to Charlotte. Since then, he has been practicing at Novant Health Pulmonary and Critical Care. Dr. Walls has been married to his wife, Jana, for 35 years and is the proud father of 2 adult children. Also joining us today, we have Jennifer Fulkenroth. Jennifer is the Senior Director of Nationwide Tobacco Programs at the American Lung Association, with over 20 years of experience in tobacco and nicotine dependence treatment across both clinical and community settings. In her role, Jen advises all mission activities at the local, state, and national levels to ensure a comprehensive, evidence-based public health framework focused around education, awareness, behavior modification, community mobilization, and systems change. She is a nationally recognized tobacco cessation expert with certifications including CTTS, NCTTP, NCNTT, and CPAHATT. Thank you both for joining us today for this important discussion. We'll dive into the conversation today by focusing on the physical and the mental effects of tobacco use, as well as some medical insights into recovery. So to begin, let's set the stage by understanding what tobacco does to the body, especially the lungs. Dr. Walls, what are the most immediate physical effects on the lungs when someone uses tobacco?
Well, thank you for having me. I mean, the most immediate effect, obviously tobacco is a very strong irritant, and you can certainly have bronchoconstriction immediately. Also, as an irritant, you'll have more bronchial secretion, more mucus production. So patients immediately, now over time, as a smoker has smoked for many years, they'll have less of that immediate reaction, but certainly there is an immediate effect with smoking, but more throughout the body. You'll have vasoconstriction, more higher heart rate, higher blood pressure. So it does have both some immediate pulmonary and cardiac effects.
Can you elaborate more on some of the long-term damage that tobacco causes to the respiratory system?
So what I see every day in the office, the most common thing that we talk about or hear about in the media is COPD. And COPD is really a mix of 2 things that happen in the lungs with chronic tobacco exposure. Emphysema is a damage that occurs to the small air sacs in the lung that is induced by the inflammation that cigarette smoke causes. And that inflammation creates enough damage that it breaks down the walls of these air sacs and the elastic fibers that keep the lung very compliant. And it leads to these dilated areas of called blebs or emphysematous spaces. And the airways become very floppy and obstructed. And that is what leads to a lot of the disability with emphysema. But chronic bronchitis also forms in a large portion of patients, and you'll get a mucus gland um, hyper hypersecretion of these mucus glands that causes mucus formation in the lungs, but also a thickening of the airways with these proliferation of mucus glands, and you get a chronic cough with sputum production on a daily basis. And many patients have a mix of both of these things. So that's the biggest thing we see with the long-term effects, in addition to the risk of cancer, obviously.
Well, that's a great segue into the next question. How does smoking contribute to the development of chronic diseases beyond the lungs, so such as heart disease or cancer?
Well, the cancer, I mean, there's thousands of chemicals in cigarette smoke, and many have been identified to directly damage lung cells and therefore damage the DNA in lung cells. So these these particulate substances in cigarette smoke and chemicals directly damage DNA, which leads to, we know that cancer is caused by DNA damage. And so it's hard to, in an individual, pick out which chemical actually causes it. But we do know that obviously most lung cancers in this country are caused by cigarette smoke. And cardiovascular disease and other vascular diseases, we know that tobacco smoke, nicotine causes vasoconstriction. It increases peripheral vascular disease is a huge risk with cigarette smoking. So peripheral vascular narrowing with plaques and atherosclerosis, and also in the coronary arteries through their indirect effects. So cigarette smoking does have quite a bit of effects with both cancer and cardiovascular disease.
I know that many people may delay seeking help or talking to their doctor because they might not recognize warning signs. So, what are some of the signs of tobacco related damage that patients often ignore until it might be too late?
I think subtle changes in shortness of breath, and people sometimes don't realize that they're doing less and less because they limit their activities because they start to feel shorter breath earlier. So when patients are starting to limit what they do because it makes them uncomfortable to do more, then that may be a sign that they're developing obstruction. Chronic cough or chronic sputum production, again, can be a sign of chronic bronchitis, which can lead to chronic airflow obstruction. So I think subtle changes in breathing or activity related to avoidance of shortness of breath or is one thing that people will kind of ignore. And also that kind of chronic cough, which is often associated with long-term damage to the airways.
I understand that quitting can have benefits almost immediately. So, how quickly would you say that lung function can begin to improve after quitting tobacco?
It improves very quickly. I mean, the other thing we didn't talk about, even without lung function, is, your carbon monoxide levels go down immediately because smoking does increase that. So you have better oxygen carrying capacity immediately in your bloodstream. But the airways, over at least the first year that you quit smoking, do experience a significant improvement in airflow. That does take some time, but I mean, there are immediate but also tangible long-term benefits. And we know that smokers who quit smoking lose lung function at about half the rate as people who continue to smoke on average.
Are there any lesser known but potentially serious consequences of tobacco use on physical health?
Sure. I mean, in addition to the lung cancer, we talked about cardiovascular risks. There are multiple other malignancies that have been associated with lung cancer, including head and neck cancers, esophageal cancers, to name a few. And there are a lot of the more obscure lung diseases that we see are also very closely tied to smoking. So I would say, in addition to cardiovascular disease and lung disease, there are a lot of other cancers that are certainly related to smoking, and many other medical conditions that are exacerbated by smoking.
Thank you for all that information. I'll come back to you in just a moment, Dr. Walls. Now let's shift our focus to talk about strategies and support for quitting tobacco for good. So Jennifer, I'll direct these questions to you. So what are the most effective evidence-based strategies for quitting tobacco today?
So the most effective quit methods we know include a three-way combination. So first and foremost, a behavioral counseling program, an evidence-based program can really help an individual to tailor their quit plan to really make it right for them. The second component is FDA-approved cessation medication. And this is something you want to talk with your primary care provider or clinician about to really get a thorough understanding of all of the different medications that are available out there for you. And then the third component to a proven effective treatment plan would be support, and making sure support comes in a variety of different avenues through online communities, your neighbors, your family, your friends, your coworkers. The more support you have, the stronger your quit attempt can truly be. So counseling, medication, and support.
I know that, there's so much great information on the internet, and there's also a lot of myths and roadblocks that can make quitting harder than it has to be. So what are some of the common misconceptions that make quitting harder for tobacco users?
Yeah, so I believe one really large misconception is that you need to quit cold turkey. And that means no counseling, no medication, don't tell anyone about it, make the quit attempt. Unfortunately, this really works against us. With the right plan in place, the correct medication, and adequate support, you really are increasing your chances of success. I think another misconception is that individuals who use tobacco products are bad people with a bad habit. And in fact, the truth really is these are incredibly great people that were unfortunately hooked and addicted under the tobacco industry's manipulation, younger in the years, and succumbed to an incredibly difficult dependency on tobacco. So it's really important that we kind of extinguish the myth and understand that tobacco use and dependence is a chronic relapsing condition that requires repeat intervention and long-term support. That in fact, if you've tried to quit in the past, it was not a failure. In fact, it was a learning lesson to the stepping stones that can be successful moving forward, and to just never give up.
Good information there. Can you talk about the role of nicotine replacement therapies and how they should be used properly?
Yeah, so there are 7 FDA-approved cessation medications. 2 do not contain nicotine, and those are prescription. And then 5 do contain nicotine. And that's what we refer to as nicotine replacement therapy. Give you an example, the patch, the nicotine gum, the nicotine lozenge, these are all categorized as nicotine replacement therapy. They can really be beneficial in an individual's quit attempt, as they really help to provide your body with the same level of nicotine you are currently taking in with other tobacco products, but in their cleanest, purest form. They are FDA approved and proven effective for cessation. And basically, they help to stimulate the brain receptors and release that chemical dopamine, that happy feel-good chemical, to really help you to have coverage in place to minimize urges and cravings, both the intensity and the frequency during your quit attempt. That's the physical challenges. So by having that in place, you're able to kind of address some of the other challenges associated with the quit attempt while having that nicotine delivered throughout the day. We really do recommend that individuals talk to their primary care provider or clinician about the different nicotine replacement therapies, and also the benefit in potentially doing combination therapy, which includes a long-term medication such as the patch, which you use once every 24 hours, in addition to a low dose, low milligram, short-term medication, such as the nicotine gum or the nicotine lozenge, that can be used in addition to the patch for breakthrough cravings as needed throughout the day.
We're going to discuss vaping more in a moment. But of course, we know that not all tobacco users are the same. So some smoke, some vape, others choose to use smokeless tobacco. how do you tailor cessation plans for different types of tobacco users?
Yeah, I think this is something the American Lung Association certainly it does very, very effectively. So it is so very important that, there is no one size fits all. Tobacco treatment plans can be tailored based on the type of tobacco product being used, the amount of nicotine being dosed every single day, as well as the frequency of use throughout the day. If using nicotine replacement therapy, we really want to start kind of at that same level of nicotine that the individual is currently used to when they start their quit date. The real importance in tailoring it also comes down to the behavioral aspect of it. So the actual frequency and duration of use. I'll give you an example. If you are a smokeless tobacco user, you are used to putting the chew between your cheek and your gum. This, in fact, could be better replaced behaviorally with, a nicotine lozenge or gum placed in that same location. Or if using a prescription medication, you can use a smooth pebble about the same size as the wad that you typically put in there, just to kind of fill that void. Same with conventional cigarette smoking. We notice that a lot of patients appreciate use of just cinnamon sticks that you can get in the spice aisle at the grocery store, holding them between their fingers and kind of puffing through them and just kind of filling that void. So really by making sure you're matching not only the nicotine dosage of the products that you're using, but also some of the key strategies for the behavioral components of the addiction to help overcome and replace with healthier alternatives.
Great information there. We know that quitting is, not just a physical act, it's obviously a mental and an emotional journey. So, what are some of the psychological or emotional challenges that people face when trying to quit, and how can they best be addressed?
Yeah. So, over time, using tobacco products becomes almost an automatic behavior that really needs to be unlearned. We took a lot of time learning the techniques and the patterns of use, and then it becomes so automatic that now we need to unlearn that. So, certain activities and environmental cues can certainly trigger the urge to use these products. So, after quitting, emotions can feel overwhelming for the individual. Grief can also play a really important role in the quit process and just understanding that grief process and how it's connected throughout your journey to freedom. When it comes to the psychological challenges associated with quitting, some of the techniques that we have found proven effective in helping individuals to overcome those would include creating support systems, rewarding yourself for avoiding use, marking your calendar every day that you remain tobacco free, attending regular counseling and classes, really understanding the myths versus the truths of tobacco use, and using positive self-talk messaging, understanding that the urge will pass whether you smoke or not. So in fact, you do have the power to overcome that and get to the other side. Many times, in my own opinion, the psychological challenges associated with quitting can be some of the toughest. So it's really important to enroll in counseling programs to really build up the treatment plan for those psychological aspects that you will face.
Let's talk about some modern tools to help people quit. Are there any newer digital tools, say like apps or telehealth platforms, that have proven effective in supporting cessation?
Yeah. So, again, we know not one size fits all. So, the more innovative, creative technologies that we have out there, the better. And at the end of the day, the most important part is knowing that there are several modalities. So, if one doesn't work for one individual, it may be vital for another. In terms of digital, so we are finding that one of the best programs that's working currently, giving an example, American Lung Association's Freedom from Smoking Plus program. This is a digital online tool that allows an individual to access all 9 sessions of the evidence-based proven effective course, but right through your digital device, your smartphone, your tablet, your laptop. This is also self-paced. So individuals really appreciate that because they can set their own quit date, they can pace themselves through the sessions and activities, and really quit with confidence, knowing that they are prepared. Another thing we really love about this new digital online tool is that it provides one full year of continuous support. We know that individuals struggle, throughout not only their quit attempt, but in fact, maintaining that new tobacco-free lifestyle. So therefore, this program supports you one full year for any slips that may occur, any potential relapses that may occur, to really help get you back on track. So this new digital online tool has been really successful and great, I think mostly because it fits in your pocket and goes anywhere you want to go.
That's a great resource. We'll make sure to send that out to everyone after the webinar today. So you've talked about this a few times, the importance of support. So no one should feel like they have to quit alone. So how can family members or friends support someone who's trying to quit tobacco?
Family members and friends can really help an individual through support with positivity. No finger pointing or shaming. Many times, individuals who use tobacco products have a lot of internal shame that occurs. But in fact, again, these are really good people with just an incredibly difficult addiction and dependency to break. So encouraging them and enrolling in a counseling program, encouraging them to talk to their primary care provider about the FDA-approved medications, and that in fact, that just helps to increase their chances of success. Really supporting them leading up to that quit date and after, and really, celebrating those milestones with them. They're 1 month tobacco free, they're 2 month tobacco free. And don't forget about their efforts too. I also notice with a lot of families that we work with, they're incredibly supportive surrounding the quit date and maybe a week or two after, but over time move on. Whereas that individual is still struggling for a full year or more in really helping to absorb that new tobacco-free image. So continuing to remind them that you're proud of them, and that you're there for them, regardless of how far away from the quit date it is, that every step along the way, you're just a text or a phone call or a cup of coffee away.
Let's shift gears and we'll talk about a topic that's especially relevant today. So vaping and e-cigarettes. This area is evolving fast, and many people are unsure where it fits into the broader conversation on tobacco use. So I'm going to start, Dr. Walls, with you, a question directed to you. So how do vaping and e-cigarettes affect the lungs compared to traditional cigarettes? And then as a part two of that question, have you treated patients with lung conditions directly linked to vaping?
Thank you. It's a great question that unfortunately we don't know all the information yet about it. It's still fairly new, and vaping products vary. There was a lot of concern about EVOLI, which was the e-cigarette vaping associated lung injury that was occurring 5 or 6 years ago. That did seem to be linked with vitamin E acetate carrier that was in mainly some of the marijuana products, quite frankly. But the vaping itself, the vaping products that are out there now, we just don't have long-term data on how that affects the lungs. So it's difficult to comment on what we will see 20 years down the road. We're certainly looking to get more information on that. There's a lot of debate within the pulmonary community about whether we should be allowing people to vape as a way to get off cigarettes. Is that a less harmful way of getting nicotine in your system? But we just don't know yet. And it's not recommended that you use vaping as a way to get people to stop smoking cigarettes, because you're just trading that one addiction for another and with unknown consequences.
Jennifer, I'll direct this question to you. Are there specific programs or resources designed for e-cigarette users? And I'll ask specifically about teens and young adults.
Sure, sure. So, absolutely. One thing we have done very diligently is, conduct hearty research on e-cigarette and vaping device use, patterns, techniques for effectively quitting, and strategies that can be most helpful for individuals that use these products. For teens specifically, the American Lung Association has the Not on Tobacco program. This is a voluntary youth cessation program that really can help guide a teen into a journey to freedom, not only for, removing tobacco and nicotine product use from their lifestyles, but also replacing them with healthy alternatives, and much of which, because we are talking with youth, have to do with mental wellness and mental health. So the Not on Tobacco program is available to any teen nationwide and even accessible through our digital online tool. That is called Not For Me, and it can be accessed at notforme.org. This one is specifically for teens and e-cigarettes. I will also say that we have a variety of different educational programs that can really be beneficial in helping teens to break free from, e-cigarette and vaping devices. One, we have a new training available through Lung.Training for parents. It's called Talk to Your Child About Vaping. And this training, in fact, will help walk parents through understanding what these products look like, what the impact is on the adolescent brain health and development, as well as strategies to really have an open conversation with their teens about these products, whether it be a preventative conversation or an intervention conversation should you find out that your teen is currently using or has used these products. So a variety of different resources, as well as cessation programs that are tailored specifically to help these individuals.
Much needed. This has been a great discussion, so much amazing information. Let me check in, see if there's any questions that have been submitted. Okay, it looks like we have just two. Okay, I'll throw this out there, and either of you are welcome to answer it. Are there differences in how tobacco affects different demographics, such as by age or gender?
I think it's hard to say. I think that in general, we know that women may, I think, in many cases, be more susceptible to cigarette smoke in terms of COPD over the long term, as they. But I don't think there's a big difference there. Age. I think that the big key is that we know that the earlier you can get people to smoke, the bigger the benefit downstream. So you can save people from a lot of long-term damage if you get to them early and encourage the smoking cessation early. But I don't know of any great gender differences, other than there may be some increased susceptibility to airways disease. But I don't know if Jennifer has anything to add to that.
I would say one very interesting publication to check out pertaining to disparities specific to tobacco use would be the newest Surgeon General's report on tobacco use disparities. This really highlights many of the, unequal treatment as it pertains to tobacco industry targeted marketing. And in fact, seeing that direct impact, particularly on Black and Brown communities, having much higher risk of use, much higher rates of use, but then also higher health risks, more outcomes that are negative with lung health, as well as other aspects of health. So I would definitely recommend checking out that Surgeon General's report. It gives great detail on those disparities and those communities of highest need for services.
We'll send that a link to that report out to the group here. All right, one more question we'll fit in here. Jennifer, I think this will be directed towards you. So what resources or support systems might be available in communities that people often overlook?
I would say, for one, throughout the state, you have 1-800-QUIT Now, the state, free telephonic cessation program. You can call this at any time and really talk with a tobacco treatment counselor. about your interest in quitting and all of the different options. Also, American Lung Association has 5 different types of modalities of programming that are available. Always, feel free to look to the American Lung Association as your champion in this space and providing cessation programs to help support you in a variety of different methods that can really best meet your lifestyle and your preferences. And then I would also say, turning to community-based organization and faith-based groups. They can be incredibly supportive in an individual's journey to freedom from tobacco use. So never forget that just around every single corner, from community to your faith-based to your local hospitals and health clinics, this really is a full community approach. And there's, so many resources throughout all aspects of your community that you can really tap into to gain support.
Thank you, Jennifer. Well, before we conclude this session, we want to share some important resources regarding quitting tobacco. The American Lung Association is committed to providing the tools and resources to help you quit and quit for good. We are proud to partner with organizations like Novant Health to improve lung health through our Community Connections webinar series. So for more information, you can visit the websites that are listed on your screen. We'll include all this information in the follow-up email. If you go to the next slide, please. I just want to acknowledge and thank our amazing panelists. Thank you, Dr. Walls. Thank you, Jennifer, for your time, your insight, and your service. This has been a really great conversation. So thank you all again, and I hope that you have a wonderful day.